everybody. Masay khair. We're going to talk today about patient care pathway role of the multidisciplinary teams. As you know, worldwide dementia is increasing very rapidly, moving from 36 million in 2010 to almost 115 million in year 2050. The problem is that most of the increase will be in developing countries. Already 58% of people with dementia live in developing countries. But by 2050, this will rise to almost 71%. In our part of the world, in the MENA region, in 2010, we had 1.2 million demented patients, which increased to almost 2 million in 2020, going up to 6 million in 2050. So the increase is tremendous in our part of the world. WHO, in coordination with Alzheimer's Disease International, have put a 7-stage model for planning dementia services. And similarly, a NICE guideline in the UK put a GP dementia pathway, whereby what are the steps to be followed at the primary care level to encourage diagnosis of dementia. Problem with primary care is a lot of time when the GP is faced with the demented patient, his answer sometimes, he will tell the family, it's old age, you cannot do anything, your patient is demented. However, there is a major gap in diagnosis, and part of it is deficiency in education among general practitioners about dementia issues. One of the tricks in order to diagnose your patient, demented patient, is really to listen to your patient. If you listen to the patient carefully, you'll be able to diagnose your demented patient easily from just the history and the interview. The barrier to diagnosis and treatment are multiple, including cognitive impairment overshadowed by other comorbid psychiatric illness, time for diagnosis, lack of understanding of dementia and diagnostic process, therapeutic nihilisms, and cost associated with diagnosis and treatment. The question when to refer as a GP, when to refer to tertiary care is we refer when diagnosis or care plan is uncertain, when Alzheimer's disease, we have mixed dementia and we are not sure of the diagnosis, when there are marked behavior disturbances and risk of harm to self or others, and when there are severe mood or psychotic symptoms. Primary care challenges are optimally positioned to detect the earliest signs and symptoms of cognitive impairment dementia. And in one study, they were saying that triaging patients at the primary care level based on the use of an objective cognition screening tool, along with in-development blood-based biomarkers, represent a potentially efficient and cost-effective path to accurately identifying incipient Alzheimer's disease-related cognitive decline earlier in the disease course. With necessary training, primary care doctor can play an important role in detecting and diagnosing early symptoms, can act as a gateway to services, including community-based and specialist services. With strong primary care foundations and network will allow stable cases of dementia to be managed in the community. And at the same time, effective certification will allow specialists more time to handle complex cases.